Hello, good morning, everyone. My name is Radwa. I did my first case study on anaphylaxis. So let's get started. Our agenda for today, we will be discussing our patient, his symptoms, his relevant history, physical findings, the diagnosis, and the diagnostic test that would confirm his diagnosis. We will also discuss his treatment plan. So let's meet our patient. Our patient is a 5 years old white male. He goes by the name of Jimmy. He is accompanied by his mother. He presents to our ED with a chief complaint of acute onset of dyspnea. As per his mother, the occurrence followed what is described as an insect sting that happened approximately 40 minutes prior to his arrival to our ED. Since then, he had rapidly produced facial edema, redness, and dizziness. The patient's mother also mentioned that she used his rescue inhaler twice, and it didn't really alleviate his symptoms. His symptoms, in fact, got progressively worse since the onset. For allergies, he has no known allergies to medicine, food, or environmental. He has a past medical history of asthma that he was diagnosed with 7 months prior to today's visit. His mother denies any past surgical history. The medications that he's currently on are Zipnex and Advair. So for his physical examination, which includes the PAT assessment for the pediatrics, we'll start with his vitals. He is currently dyspneic. He's breathing at 35 times a minute. He's sat in 89% on room air. His heart rate is 137 beats per minute. His blood pressure is currently 89/51, has a temp of 37.2 Celsius. On the AKG, he is sinus tach with a blood sugar of 6.6. So, to describe his general appearance, the patient is sitting up on a hospital stretcher. He appears to be in mild distress. He has noticeable angioedema around his eyes and mouth. His face is flushed. You can clearly hear audible wheezing, and he has hoarseness of his voice. He can speak to you in 4 to 5 words before he needs to pause for air. Um, so his clinical presentation, skin-wise, he is flushed. You can see urticaria, bursitis. He has angioedema and he is warm to the touch. Respiratory-wise, he has the audible wheezing, his dyspneic and hoarseness of his voice. GI, he's nauseous. Cardiovascular, he's starting to have arrhythmias. He has hypotension. He's tachycardic and he's hypoxic. He's satting 89% on room air. Neurological symptoms, he is dizzy and starting to get agitated. Other symptoms, he's telling you that he has weird taste in his mouth, along with rhinorrhea and increased lacrimation. So his diagnosis fits anaphylaxis. And the signs and symptoms that would fit that category, or that diagnosis rather, is that he has one of the most common triggers of anaphylaxis, which is insect bite. Um, Also, the timing of the signs and symptoms were within 1 hour of the exposure. He did arrive to our ED stating, well, his mother stated that the exposure happened 40 minutes prior. He's also having cardio and respiratory symptoms. As you remember, he was having the wheezing, he was having dyspnea, he was having the hoarseness of his voice. More important, he was starting to have neurological changes also. Um, he was dizzy and he was starting to have agitations. He also has a past medical history of asthma, which is compared to the general population, the risk of anaphylaxis is doubled with patients with asthma. So, what kind of tests can we do for anaphylaxis? Unfortunately, there is no available lab test to confirm or assist in the diagnosis of anaphylaxis in real time. That is in the emergency room and urgent care setting. During an acute event, diagnosing a patient with anaphylaxis within the first few minutes of their arrival is really based on their clinical presentations. Obtaining a detailed history of any recent exposure will assist with a proper treatment plan. Once the patient has been stabilized, we would do blood work on them to measure the level of their white blood count, including a level called trypase. Trypase is an enzyme that is found in activated mast cells, along with histamine and other chemicals that are found during an allergic reaction. Um, when mast cells are activated to an allergic reaction, there's a rapid increase in the level of trypase within the first few minutes up to few hours from the exposure to the allergen. That's why that is one of um, the things that would be tested in the ED. Um, Therefore, getting that sample is really time sensitive and must be obtained within 3 hours of the exposure. Although a trypase test is used to assist providers with a diagnosis of anaphylaxis, the test itself is non-specific. It really is primarily used to test for mast cells disorders. So this patient will eventually need to go for a skin test panel to confirm his allergies. If you take a look to the right bottom of the screen, the picture, that is an example of a skin test panel that would confirm what the patient is allergic to. For treatment, so anaphylaxis is a medical emergency and it needs immediate care. Like in any emergent situations, we need to follow the CAB algorithm. Um, but the medication that would be used is epinephrine, which is really the cornerstone of management of anaphylaxis. It's used to reduce the body's allergic response. In this scenario, we're going to focus on a pediatric dose because our patient is 5 years old. The dose for children is 0.01 ml per kilograms, and it can be used up to a max dose of 0.3 mLs and is diluted in 1 to 1,000. It's administered IM. This dose can be re-injected every 5 to 15 minutes until the symptoms have been alleviated or the patient starts to show side effects of it. Side effects would include tremors, palpitations, or anxiety. Um, the provider would um would give the patient oxygen, of course, to help to compensate for restricted breathing. We would administer IV antihistamines or cortisone in order to reduce inflammation or air passage and to improve our patient's breathing. Albuterol would also be given to relieve breathing symptoms. Those are my references that I have used to gather all the information during my PowerPoint. Thank you guys so much for listening. If you have any questions, please let me know. Thank you so much.